The Jefferson Regional Health Alliance that I work for is basically a collaborative think tank of healthcare leaders. The board put representatives from their organizations together to start talking about what would it look like if Jackson and Josephine County had one community health assessment and then a community health improvement plan, which would basically be a health strategic plan for the two counties.
Last month, the local Alcohol and Drug Planning Committee met to discuss the new Community Health Improvement Plan, which aims at improving the overall health of our community over the next few years. Based on an ambitious community health assessment carried out in 2018, it was determined that the CHIP should focus on behavioral health, parenting support and life skills, and affordable housing in Jackson County. Here are the highlights of that meeting.
So I've been a part of a lot of local conversations around the jail lately, and I don't want to politicize our next presenter, but one of the questions that comes up is what kind of efforts and resources are going into conversations around coordinating care and what our community needs are and how to improve those things. And so we do have a process that's in place in our county as well as others, and Angela Warren has been the person that spearheaded that. Angela, thank you so much for coming today.
The Jefferson Regional Health Alliance that I work for is basically a collaborative think tank of healthcare leaders. And truly, its sole purpose is that systems level collaboration and giving those CEO level leaders a place to be with their peers to have those kinds of conversations. And so in 2016, we formed a steering committee. The board put representatives from their organizations together to start talking about what would it look like if Jackson and Josephine County had one community health assessment. That was that high-level strategic look at the community, and then a community health improvement plan, which would basically be a health strategic plan for the two counties. And that's what you have in front of you, the CHIP, or those of you that have the excerpts, the behavioral health section of the CHIP, which was just finished in June of this year. So this is called All In for Health. It is separate from JRHA. It is a community-wide initiative. We're just basically the backbone organization that holds it, and right now, as their staff member, I'm sort of the coordinator of the project. But honestly, it's community members like Darren, like Danny Swafford, who are chairing the work groups, who are helping write the documents, who are helping us figure out how to move forward with this work. Community health assessment, which if you haven't seen it, it is a giant reference document. It's available online. The link is there, and it'll be at the end of the slideshow as well, to a lot of data that was gathered over a one-year period. We brought in some consultants from outside the area who've done this sort of thing in collaborative communities before. And they looked at a lot of data and they asked a lot of questions of our community to help us figure out what are our strengths and what are our needs. And that document was completed in December of 2018 and then was taken as the basis. The community feedback that came in that and the analysis of the data in that is what drove the health improvement plan that we're working from. The health improvement plan was exactly that, taking the top priorities that rose to the top for our community in the assessment and putting it into some kind of a health improvement plan, goals and strategies that we could as a community start taking action on. So the organizing in this area, Jackson, Josephine County, you all know all of this. 3 CCOs, 2 hospital systems, 3 federally qualified health centers, 2 local public health authorities, mental health authorities. It was a lot of significant high-level partners who had requirements to do assessments and plans, plus a lot of partners that use those assessments and plans. So we had to figure out if you're a CCO and you have to do it every 5 years, or you're a hospital and you have to do it every 3 years, or you're a public health department that has every 5 years, or you're a federally qualified health center who every 2 years has to use data from a recent assessment. How do we find a cycle that will meet everyone's needs and be current enough that we can do it together? And what ended up happening after about a year of work is that Asante and Providence let our steering committee collaboratively participate in their hospital, their separate hospital health needs assessments that they did back in 2016 and 2017. And then they agreed to go and do the whole thing a year early collaboratively and stop doing it by themselves. And so they took on the expense of doing it early and partnering with the rest of the community. And we found that by doing the community assessment in 18, we could get on a 3-year cycle that would meet everyone's needs. So we completed it in 18, the plan in 19, we'll do it again in 21 and 22, and the 3-year cycle hopefully will then be sustainable for everyone. Then we did some visioning and community building at the first part of 2017, and this is where we really started to deal with what you probably, many of you may have seen before, is this collaborative continuum of turf versus trust. Everybody theoretically wants this to work because collaboratively it does make sense. But when you get down to the nitty-gritty of, okay, but I have to report to my board and we have to do it this way in order to continue to be able to assess things as we have been, there's a lot of back and forth. And so we spent a significant amount of time, and I will tell you, as we've learned from others in other parts of the state, we have significant collaboration and collaborative willingness in this community that a lot of communities don't have. We're really, really fortunate to have been able to get over some pretty big hurdles to do this big thing together. So, the big change, and if any of you are on the Asante or Providence hospital boards, you would know that as a hospital board, when you get your community health needs assessment in the past, typically it's going to be focused on cardiovascular disease and diabetes, and you're going to have things that sound like what you'd expect to find in a health assessment. Because this was a community collaborative high-level document, we were using a different lens. We were going through the social determinants of health, which is why when you see the priorities, you won't find cardiovascular disease as one of the targets that we're trying to improve. You will find housing, and you will find behavioral health, and you will find parenting skills. So a very different look at health as a community. After we got all of those 200 data sources and the information that was captured by the focus groups and forums and the survey data, and they ran it through all of the algorithms and things that they do at the consultancy, they came back to us with a whole bunch of information and said, all right, let's start looking at the mess of stuff that we've gathered here and trying to add some conversations and assessment around that. And they came in and spent time in small groups working on what are the things that are impacting or could potentially impact health in our community. And of course, obviously, two big things that came up. One was the marijuana industry and how it's changing all sorts of things. And one was smoke and fires in our valley. That there are two big things that everybody says is impacting way more than you would have thought. And so there were really good discussions around those. And after about 2 or 3 months, the consultants came back to us with a big report out, a big community report out, where they shared what they had seen rise to the top. The drug and alcohol use was the #1 priority that came out of the assessment as an issue concerning health of our providers and of our community members. The second priority out of the community health assessment was affordable housing. Next one, mental health, was third. And the fact that substance use and mental health were in the top 3 together, as you'll see when we get to the CHIP, meant that behavioral health became kind of #1 for us in looking at the health improvement plan. The next topic that came up was parenting support and life skills, ways to wrap our families in ways to build resilience and to understand how to be strong families for their children, ways that they can access community supports, parenting education. The next thing was to take all of that and identify and prioritize the strategic issues. So these are the 6 key themes that were prioritized. And out of these, there was another process then to go through and figure out what can we tackle in 2019, 2022 with this current community health improvement plan. Behavioral health, mental health and substance use, parenting support and life skills, and safe, affordable, accessible housing. Those 3 then had to be put into some kind of a plan. What are we going to try and do about that in terms of a strategic plan? So the document you have in front of you is the result of that. And in behavioral health, what we ended up with as the 6 high-level community goals are lessening the effects of trauma, helping young people and older adults feel less alone, because those were 2 identified vulnerable populations, especially in terms of suicide ideation. Providing the community with ways to accept and help people who need behavioral health services, preventing the use and misuse of substances, promoting ways to reduce the harm that happens with mental health and substance use issues, and we focused on some harm reduction strategies, and then improve access and coordination of care for people needing mental health and addiction services. In the parenting support and life skills, the 4 goals: help families feel connected, cared for, and strengthened, help families have access to safe, affordable, and quality child care, increase access to healthy food, and have community-based organizations working together to help deliver coordinated services. And then the third priority area, housing, increase the number of people that are paying 30% or less of what they earn for housing, and increase the number of people that are living in homes that are safe, accessible, and easily served by community services. So, as of July, starting into the action cycle, what do we do with this now that we've got it? Because the reality is, it's a strategic plan for the community, so it's not like the Regional Health Alliance or any one organization is going to activate all of those things, but it's who in the community is already doing some of that work or is about to take on that work, or who, looking at this chip, says, that's a fit for us. That fits our mission and our work plan and where we're trying to head. So the next step with all of this, now that we've got this document, the work groups are going, is we have created a series of tools to start to gather the objectives and action steps and process measures of organizations and agencies who are doing current work that aligns with the CHIP. So if you look at the example there, and it's small enough you may not be able to see it, but the goal has already been set in the CHIP. The population outcome measures, the strategies have been set in the CHIP. What we're looking at now is in your organization, when you look at your strategic plan and your mission and your work plan for the coming year or 3 years, what are organizational objectives you have that tie in, that are supporting these goals and strategies? What are the action steps you're going to take to achieve your objective, and how are you going to measure what you did? And we're asking that organizations submit those things to this collective, and then we will be reporting out quarterly, initially, to all the partners around the work group table around what's happening, so that we can start to see places where there might be opportunities for partnership, or where we might start to see gaps emerge that help somebody say, wow, our organization's looking to take on something new and it looks like nothing's happening over here, and this would be a good place for us. If you are interested in downloading or searching or having access to either of these documents or a host of other things, and that gives you contact information for me or for others connected with the project for specific questions.